Now we're going to move on, and the next presenter, actually one of the most compelling and interesting presenters that I have come across. I've heard Áine Carroll, Professor Áine Carroll from UCD, give several talks. There are always lots of images, lots of thought-provoking ideas, and Áine is going to talk to us about the Horizon 2020 project ValueCare and some of the key concepts behind that. So welcome, Áine. Look forward to hearing your talk.
Thank you very much, Martin. It's a pleasure to be here, and I feel under ferocious pressure now speaking after those excellent speakers that you've already had, but I'll do my very best, and I'll maybe pick up on a few things that the previous speakers have spoken about. So basically, my areas of interest are integrated care, but also complex adaptive systems theory and its application to health and care. And I think the previous speakers have already really made the case for the need for integrated care. And Henrik, if I might, do we know where we're going to? Well, in Ireland, we actually do, because our patients have told us. So what they want from person-centred coordinated care in Ireland is access to and continuity in the services I need when and where I need them. It's underpinned by a comprehensive assessment of my life and my world, together with the information and support I need. It demonstrates respect for my preferences, building care around me and those involved in my care. And for those of you that are interested, that how we went about that project has just been published in the International Journal of Integrated Care. So that is where we need to go to. And until we can actually say yes to all those underlined areas, we will know that we haven't got there. So we have started a journey, but we have a long way to go. So when it comes to integrated care, then, you can see that in the vision document that was produced by the International Foundation for Integrated Care last year, in the advent of COVID, and which I was very privileged to be part of, you can see that digital is one of the 9 pillars of integrated care. So digital is extremely important and is often referred to as the glue and the grease for integrated care. So you were asking Martin Kieran about, is it an enabler or is it an essential component? So I would make the case that it's an essential component. We cannot do integrated care without having digital really working to support the work that we're doing. So it is my pleasure to be speaking to you today on behalf of the team. So there is myself and my 2 colleagues, Dr. Andrew Darley, who is the postdoc researcher, and Aoibhinn Murray, who is the research manager. And if I may, I would just like to spend a moment to remember Spencer Turvey, who unfortunately died very suddenly, very recently, and is a huge loss to all the colleagues that had the pleasure and privilege of working with Spencer over the years. He was a real champion for this project, and we miss him terribly. And if you like, we want successful delivery of this project to be in memorial of Spencer Turvey. So I just want to acknowledge the contribution that Spencer made. So what is the ValueCare project? It is an EU-funded project through the H2020 funding scheme. It has a grant value of nearly €6 million. It was originally a 4-year project, but with COVID, it is now 4.5 years. It is a multidisciplinary consortium consisting of 17 partners across 8 European countries, and it involves a wide range of stakeholders involving stakeholders from health and social care, e-health technology, and we felt that was really important to maximise the chances of the project's success. So it launched in December 2019. And it's based around the need for us to do and think very differently about how we approach thinking and designing and delivering health and well-being supports for people who are aging. So it's a global priority worldwide, and we know that people are living longer, as Kieran alluded to. That's a particular success story in Ireland. But we're more likely to age with an accumulation of multiple morbidities. So to deliver efficient outcome-based integrated health and social care to older people with chronic health conditions, and in order to improve their quality of life as well as their families, we need to do all that we can from a digital point of view to support those patients and their families, and also to support the sustainability of healthcare systems in Europe. So it is value-based methodology for integrated care supported by ICT. So we aim to deliver personalised integrated health and social care and services for better outcomes for older people and improved care experience. So I think somebody previously alluded to the Quadruple Aim, and that is certainly something that this project is endeavouring to deliver. We aim to support staff satisfaction and experience and greater efficiency in the use of resources and coordination of care. And it will do this in a setting that ensures trust of users and policymakers with regard to data access, protection and sharing, and which can be replicated and deployed at large scale in other EU countries. So we seek to enhance the experience of older people through innovative digital solutions. We seek to improve the satisfaction of multidisciplinary care teams. We wish to use resources more efficiently through improved coordination and improve care outcomes and maintain quality of life for older people with frailty. So this is just a slide to show you the partners that are involved in the project, and the overall coordinator is Hein Rat in Erasmus Medical Centre. So there's quite a number of very heavy hitters there. We're very, it's a fantastic consortium, and it's a pleasure to work with such eminent colleagues. So the Quadruple Aim, which one of the previous speakers already alluded to, so we seek to deliver efficient outcome-based integrated care to older people in order to improve their quality of life. We seek to provide a secure, scalable and robust digital solution for integrated care, and also to contribute to the sustainability of health and social care systems in Europe. And I think the addition of the improved clinician experience to the original Triple Aim is extremely important. So happy staff means happy citizens and residents. So the ValueCare project in Ireland, we aim to co-design an e-health technology to support older people living with mild to moderate frailty. We hope to do that so that they can live well and independently in their home setting. And the solution will be piloted in the Cork and Kerry regions. So even going back to the proposal stage of the project, we worked very closely with the Integrated Care Programme for older people to design what the care pathway might look like and where we would carry out the pilot. And we have continued to proceed with that co-design. So phase one is the co-design of the e-health technology. That involves an iterative and collaborative process with key stakeholders. So for example, older people, family caregivers, health and social care professionals and managers. And that is a real founding principle of the project. Phase two will be piloting the solution in Cork and Kerry. So that will be the implementation of the technology in Cork and Kerry health and social care settings. And it's a large-scale controlled pilot, and we'll be looking to pilot with 240 citizens. So we're looking at mild to moderate frailty, and as everybody will know, it is a very common health condition which develops due to age-related decline in multiple body systems, which can potentially lead to sudden health status change by minor stress or event, for example, a fall or infection. Its prevalence of risk amongst community-based older adults in Ireland is significant, although it's not inevitable, and I think that's really important. It's not inevitable, and it can be avoided, as the TILDA research project has shown us. So the vision for ValueCare in practice is that the older person will be identified as frail, that they'll be referred to the ICPOP team and the integrated care pathway, that a care coordinator will be appointed, that the technology will be deployed in clinical and home settings, that it will be implemented, and we will be assessing outcomes, evaluating the impact and looking at what improvements there have been. So we're coming to the end of phase one, and we've been working very closely with our key stakeholders to capture the lived experience of older people, caregivers and health and social care professionals to design the solution. So we felt that was really important because it avoids making assumptions about what's important to people, and it focuses on services people say they want to see happen. So it's much more about what matters to you rather than what's the matter with you. So it includes key stakeholders that are involved in the care of older people. So there'll be older citizens, and we're looking for about 20, family caregivers, again about 20, health and social care professionals between 10 and 15, and health and social care managers between 5 and 10. And each of the pilot areas will be looking for those types of numbers. So stakeholder mapping and engagement has been a very important part of the project. It is a crucial step to ensure effective collaboration and that the experiences of users and communities are at the core of the design process. We're very fortunate in Ireland in having such a really rich tapestry of stakeholders and individuals that are involved in the provision of health and care supports in the community in Ireland, and particularly in Cork and Kerry. There are wonderful individuals and organisations who are providing services. So we have been connecting with the likes of Age Friendly Ireland and local community initiatives in Cork and Kerry, for example, Friendly Call Cork, men's sheds and daycare centres. And of course, we have been working very closely with the Integrated Care Programme for older people to identify key players in the care of people with frailty, both in clinical and community settings. And what I would say is that even though we have been working at identifying the key stakeholders and organisations, there's always somebody that we have missed. So we have kept our project very open so that if there's anyone that hasn't been involved in the project, that we have made sure that we have incorporated as soon as we've been contacted or as soon as we have heard about them. So we had an online information session in November 2020 to provide understanding to health and social care professionals and an invitation to participate. So where have we got to? Well, of course, COVID really changed an awful lot of what was originally planned in the protocol. However, I would say that despite COVID-19 restrictions, the co-design activities have been able to continue and data collection commenced in November 2020. And I have to say that Andrew and Aoibhinn have been absolutely fantastic at working around the challenges that COVID has presented. So it is possible, I would say to you, to do co-design virtually. And there's lots of different ways that Andrew and Aoibhinn have tried to do that, using virtual platforms, using telephone interviews, etc., etc. So it is an interactive and inclusive approach through a blend of online workshops, one-to-one interviews via telephone. And that's particularly important. What we have discovered is that not even with COVID, there are quite a number of older people who are not comfortable using technology and still prefer to use the telephone. We have further interviews and focus groups planned for March and April. And then we will have a consensus meeting with representatives from all stakeholder groups, and that will be held in later on this year to refine the proposed technology together before we pilot it. So far, the needs that have emerged are that we want something that will guide physical activity and exercise, for example, motivation, guidance, instructions, videos, reminders, nutrition, for example, education and advice, shopping guidance, recipe ideas and meal planning. Education, we know polypharmacy is a huge problem with older people and individuals with multimorbidity. So education, lists and reminders will be useful. Recreation, for example, social activities and services that are available in the local area, and active meetup groups. And then finally, cognitive stimulation, for example, daily brain teasers and crosswords, and daily orientation, for example, date, time and weather. So those are the needs that have been identified to date. And the technological needs are that the text needs to be clear and large. It needs to be simple and easy to use. So, for example, colour coding. There needs to be a consideration of senses, for example, sight, touch and hearing. That there needs to be training, and that's felt to be really requiring one-to-one classes. And even in the virtual work that we have been doing here at the National Rehabilitation Hospital, we have found that training is a really important component of successful virtual offerings. It requires simple speech activation, must involve family and friends. We need local IT support for clinicians and older people, and also access to remote consultation with health and social care practitioners. So in conclusion, we aim to place older people at the centre of their care by establishing their needs and preferences first and designing e-health technology to meet these needs in Ireland. Preliminary data shows that the technology should include educational and motivational components regarding physical activity, nutrition, medication, mental and social well-being. And the co-design process is still ongoing. And you can find out more about the project on the slides. You will see the website, We also have a Twitter handle, and of course you can always contact me or myself or Andrew. I'm Áine.Carroll@ucd.ie, and Andrew is andrew.darley@ucd.ie, and we would really welcome any questions or thoughts or anything that you might feel would be interested in getting involved in the project. So thank you very much.
Great, Áine, that was really, really interesting. I have the privilege of sitting on the steering group for this project, and we're following it, very closely in terms of a model that potentially could be more broadly adopted across the HSE and across the country. So thanks again, Áine. It was lovely. It's great.
Thanks, Martin.